My name is Patricia Jones. Following a car accident, I was transported to the Royal Brisbane Hospital. I was taken there for surgery and it was discovered that I had a secondary brain metastasis from breast cancer. This is my experience.
Hi Philip James, thanks for meeting me here to discuss Patricia Jones's case. As you are well aware, it is important for us to communicate with each other about what is best for Mrs. Jones at this stage of her treatment. A breakdown in communication could be detrimental to her care. I thought we would all make a start by discussing each of our roles and establishing clear roles. I will be taking care of Patricia's radiation therapy and will answer any questions she has about her treatment.
That is okay. I'll explain to Patricia on the type of medication that she will be needing during her treatment. I'm aware of the fact that I'm seen as an expert in medication, not just a dispenser of medication. So I'll have to spend time communicating and allow her to ask questions, as we know that leads to patients being satisfied. I would also like to explain what type of medication she will be taking to you, Philip. As her nurse, you will have the daily responsibility of making sure she takes the medication, and you will be the first port of call for any questions. I hope that is okay.
That sounds good, James. Knowing what type of medication she will be on will also help with my job as a nurse. I will be making sure that Patricia is as comfortable as possible during her stay at the hospital. My main focus will be clear communication and also symptom control. I understand that during this time, Patricia might fall into depression, which will worsen the pain that she is experiencing. I will try to manage this and, if needed, possibly suggest a psychologist. I will actively listen to her questions and concerns. If there is anything I cannot answer, I may call upon you to answer. I think that is all we have to discuss for now. Good morning, my name is Philip and I'll be your nurse here at the Royal Brisbane Hospital. I'm glad to hear that your surgery went well. I was wondering if it was a good time to speak.
That'd be alright.
My main role as a palliative care nurse is to comfort you and always keep you updated with anything you would like to know. You will be at the top priority of my care, as I am here to provide you with emotional support and will answer any of your questions. I have talked to the pharmacist James. He has recommended dexamethasone orally for your pain management. He insisted you start with a low dosage of 4 to 8 milligrams a day. This will assist in reducing the pain and symptoms for your comfort. If you have any other concerns relating to anything, I will happily answer to the best of my abilities or get in contact with other health professionals to make your stay as best as possible.
Thank you, I have no questions.
Hello Mrs. Jones, my name is James Hesse and I will be your radiation therapist here at the Royal Brisbane Hospital. Radiation therapists utilise ionising radiation to treat cancer, but your well-being emotionally and mentally as well as physically is my primary focus. So if you have any questions or need anything, feel free to ask. I'm aware that you recently had a brief consultation with your radiation oncologist about radiation therapy, treatment of your secondary brain metastasis. You will be receiving palliative whole brain radiotherapy, 30 gray and 10 fractions over 2 weeks. The treatment will take place here starting tomorrow at 11 AM. The nurse will coordinate your treatment, and I understand that you've had radiation therapy in the past, but I was just wondering if you have any questions.
What would the treatment achieve and what would the side effects be?
The treatment intended is palliative, meaning that the aim is not to cure, but to alleviate your symptoms. Unfortunately, most brain metastasis patients experience neurological symptoms, headaches, problems thinking clearly, and seizures in approximately 20% of cases. However, these symptoms correspond more to the disease progression. Radiation therapy generally increases the life expectancy of brain metastasis patients from approximately 1 month to 5 to 6 months and reduces these symptoms. However, radiation therapy may make you feel tired, and some side effects are alopecia, hair loss, dermatitis, which is a skin condition, and nausea. I understand this can be daunting, but I will try my best to ensure that you are comfortable and well looked after. Thanks very much for your time.
Hello, my name is James David Pearson. I am your pharmacist at the Royal Brisbane Hospital. My role is to monitor your pain management and symptoms that can arise from medication and radiation treatment that you wish to undertake. I've spoken to the radiation oncologist with consultation with Mr. James Hesse about treatment plans to reduce pain and symptoms during your emotional time. Our recommendations include starting a low dose of 4 to 8 milligrams of dexamethasone orally.
What does that do?
Dexamethasone is a level 3 corticosteroid used to reduce the intracranial pressure inside of your brain caused by the inflammation by the tumour. We have also recommended a palliative care option for you to receive ongoing care and assistance emotionally and physically if you are willing. I know that during a stay at hospital we have been given a lot of information that can be confusing. We'll try and keep this information as consistent as possible, as we know that it will help you during your time with us. Either the nurse or I will also update you as information changes and remain honest with you, as we know that is important to you as well.